what if this pill could make you feel healthier and younger for longer? Is this just a dream? Or is modern medicine taking us there? If you look at 5 biggest killers in the US and most of the developed world, we will see that diseases like heart disease and cancer are dominating this list. They kill millions and millions of people each year across the globe. But the problem is that we only have treatments and no cures for these diseases. Scientists and physicians are trying to tackle this problem, but the problem is, are we on the right track? The answer might be hidden behind these 2 squares. What we are looking at right now are the annual expenses of medical systems in the US and on Cuba. Although, if you break it down on per capita level, you will see that although Cuba is investing much less money than the US per citizen, they still manage to live almost as long. So what is the reason? The reason is that Cuba has one of the best science and research-based medical systems in the world. This has brought them to being #1 preventative care system in the world, and they managed to be #1 in treating and managing blood pressure. So we can learn something from them. So let us consider how medical science works today. If you have a particular disease, a scientist in a lab will try to understand your disease and find one precise thing that makes your disease special and vulnerable. Then they will look for different substances that enable the treatment or cure of this disease, and this will enable your physician to treat you. For example, if you have a nasty throat infection, you will feel sick and you will visit your physician. Your physician will then prescribe you a medication, for example, an antibiotic that has been developed in a scientific lab. If you take it for 1 or 2 weeks, you will kill off all the harmful bacteria, and this will make you healthy again. This is how science and medicine have been working for such a long time. But with increasing number of diseases as our society ages, we get to the problem that we have too many targets, and their number is increasing, and we cannot be as precise as we were before. So this is why modern medicine and modern science have to reconsider using precise tools to tackle the problem of aging. A solution could be a rather systemic approach to a health system. Our modern science, our knowledge of aging, and our knowledge of drug development are enabling us to do so already. So the question is, what are the systemic approaches to prolonging human health and lifespan? So first of all, we have biomechatronics. Biomechatronics and novel tissue engineering are fields of technology and science that are trying to replace the parts of our body as its function starts to decline. It uses knowledge of software development, fine mechanics, tissue engineering, and electronic engineering in order to create as good as natural parts of our body. For example, pacemakers. Sometimes it even goes beyond what is our mortal nature. For example, some types of exoskeletons enable their users to carry much higher loads than a normal human being should be capable of carrying. The problem of biomechatronics is, however, that we are limited in our knowledge of how our own body really works. So before we really see a rapid increase in solutions coming from biomechatronics for healthy people, we'll still have to wait. Second solution is genetic engineering. Although genetically modified organisms have created a bad image of genetics and genes, they are not so bad. Because, let's face it, every one of you is made of genes. Even puppies are made of genes. So genetic engineering uses our knowledge of molecular biology and tries to compensate for our subtle characteristics that make us sick sometimes. It tries to compensate for our molecular nature. The only problem is that it has been used only on several occasions in humans and in cases of very precisely defined diseases. So before we really can use it on healthy individuals, we still have to understand what the safety concerns are and which legal framework we can use in order to stay safe while using it. A third solution might sound simple at first, and it doesn't sound that abstract as the other ones. But I promise you, it's as sophisticated. It is to bring in some creativity in drug development and health management. What I mean by this has been very nicely said in a scientific journal, Science, recently. It says that drug discovery is turning a corner in creativity, seeking to solve more unmet medical needs with approaches that come from biological rather than chemical solutions. Human body can be both source and a solution to a disease. So if we understand what the mechanisms behind this are, we can apply this knowledge in order to prevent disease and to postpone it at least to a later stage of our lives. This is what I like to call using the natural longevity of our body. And this is what Cuba has been doing for such a long time. So the only question that remains is, how do we do this? If you look, it's quite simple, guys. So it's stop treating your body badly. If you look in different health magazines, science journals, you will see that healthy lifestyle enables you to live healthier for longer. So you're supposed to run 30 minutes every day to prevent metabolic diseases. Do 10 push-ups a day to prevent muscle loss during aging. Scientists say that you're supposed to have to drink a glass of wine every day. But if you drink a second glass, then you're an alcoholic. So the list goes on, and the problem is, the deeper you go into it, the more confusing it gets. So is there another way? This is where biology kicks in again. Our body is made of cells, and cells work like factories. When raw materials are brought to our cells, cells switch on their molecular machines, and these molecular machines enable production of energy from this raw material. In this way, our body produces energy to use it for whatever you might think of, for running, for thinking, for falling in love, or even sleeping. But while the energy is being produced in our body produces also some byproducts, and those are considered trash, because our cells don't really know what to do with these unnecessary molecules. So they have been stored in a nice little recycling bin in the cell and put away. But the more trash you store, the more crowded your cells get. And a crowded cell is not very well functioning cell. This is the point where we sometimes get sick. The funny thing about this process is, however, that trash can be used to produce some energy. This is why cells have developed their own recycling program. They just don't like to do it. This program is called autophagy in science, and it is basically a cellular process that enables the degradation of unnecessary molecules in order to build building blocks for necessary molecules plus energy. It is, in a way, our own sustainability policy in the body. It sounds very nice, but the question remains, how do we do it? And you won't like the answer. Stop eating. Fasting is one of the most efficient ways and the most natural way to switch on autophagy. While it has a nasty side effect that when we are hungry, we become grumpy, our body learns to deal with this grumpiness with time, and this is where it really kicks in. So while scientific evidence of positive effects of fasting is increasing, the one particular problem still remains unsolved. This schnitzel, guys, looks so amazing, right? Before I start a scientific project, I like to do a proof of concept on my own body. And through last several years of working in science, I have tried different diets, different nutritional plans, different lifestyles. And what I've learned that's common to all of them is one particular thing, that when we lack time and motivation to do things like lifestyles, then we stop doing it. So the lack of determination and lack of time is what's called having a life. And a similar response is what I get from our participants in our clinical studies after they have tried to do a particular treatment. So is there another solution other than fasting to activate autophagy? Is there additional solution for health maintenance? Until recently, autophagy has been neglected by scientific society and society in general. But in 2016, Nobel Prize for Medicine and Physiology was awarded to Dr. Asumi, who in the 90s explained how this process really works and which genes are involved in it. This has motivated hundreds of scientists like myself to examine this process in more detail. And while we have been examining it, we have found out that it is one of the best ways to keep your cells healthy. Governments and industry are also acknowledging this topic, and they're starting to move on from rather reactive medicine that we had before to more proactive treatments. Public is also accepting, finally, that age-related diseases are a huge problem that we have to face. And they are trying to focus on staying healthy now than treating diseases. So if you don't want to stay healthy for everyone else's sake, then at least stay for your own. Because let's face it, healthy cells are happy cells. And how do we keep our cells happy? Other than fasting. Scientists now know of several natural substances that can do so. Resveratrol, rapamycin, and spermidine are the ones that are used most commonly in scientific labs. And we have been using these for decades already in scientific lab to activate autophagy and prolong lifespan. At the moment, some of these are even capable, some of these are also available as natural extracts that you can take in the form of a pill. So, this audience reminds me of a really nice little story from Greek mythology. And why so? Because I see that most of you guys are very young people. And if you look at the current statistics, we are expected to be 80, 90, or even 100 years old. But no one is really telling us what to do with these extra years of our life. And it's our decision if we want to stay healthy or be sick. So the story of Tithonus and Eos is a nice one to explain this problem. Tithonus was a handsome young guy from ancient Greece. And Eos, who was immortal, fell in love with him. Eos visited Zeus to grant her lover an immortality so they can spend eternal life together. But Zeus was a prick if you read Greek mythology, granted Eos immortality but tricked him and didn't give him eternal health and eternal youth. So time passed by and the young Greek guy became old, sick, senile, and grumpy. That, sorry guys, but pissed Eos off. And in the end, she turned Tithonus into a cricket. What we learn from this story is that living forever is a nice thing to do, but if we don't stay healthy during this process, it can be a quite hard time. So what can we do to stay healthy? Do we want to become a Tithonus, or do we want to have a happy life? Well, science already knows some things about it. So the easiest way is for everyone above 25, once or twice in a year, you should do several days of fasting. This helps you keep your cells clean, and clean cells are happy cells. On the other side, if you enjoy drinking coffee, try drinking it in a proper way. This means without sugar and without any milk, because this gives you a little switch on of the autophagy every day. For the ones among you who are athletes and like to do sports, try doing your physical activity in the morning before you eat your first bite, because in this way, you get an extra boost of the autophagy in a day. And last, try focusing your nutrition on foods that contain substances that activate autophagy. In order to help you with this, a scientific group that I was working with has developed this pill. Now that we have this pill that helps us feel younger and healthier, I invite you to join me on making our future better. I invite you to join me on changing health statistics. Thank you.